Why do you think there are so many misdiagnoses with this disease?
Because it's complicated and it's controversial, and there are a lot of issues with testing. And I think in our current medical community, doctors are trained to look at a cluster of symptoms and, make a diagnosis that is backed up pretty much by a test result. And so it's, you're either positive or negative on a test. And I think that a lot of people don't know what they're looking at. So we have direct tests. And let's just talk for the sake of Borrelia right now, for the sake of Lyme. So Lyme does not like to be in the bloodstream. Lyme likes to leave the bloodstream as soon as possible and burrow into the extracellular matrix and go to places like joints because there's not a lot of blood flow there. It gets our joints gets its nutrients from synovial fluid, not from actual like blood flow. So it goes to the joint. What does the joint have? Cartilage, ligaments, tendons, right? All this connective tissue that is just filled with collagen for it to eat. And
Mm.
so there's less immune cells and, like I said, no blood flow. So if you're doing a test where you draw someone's blood and you're looking for the genetic information or a PCR, which is direct testing for the infection, most likely you're not going to find it there. Okay. Now, if you're doing an indirect test, which is what the antibody tests are, now you're relying on the immune system's ability to make antibodies against this bacteria. And what this bacteria does is it actually breaks the immune system in a multitude of ways. But one of those ways is by impairing the B cells' ability to make antibodies. So, most of the testing out there is looking at the immune system's antibody response to measure an infection that a lot of times can decrease antibody response. So it's just a flawed way of looking at things, but there isn't really a better way.
Mm.
Another thing is that with conventional lab testing, they're really only looking at Borrelia burgdorferi, and there's a multitude of other species that cause Lyme or tick-borne relapsing fever. And so if you're not looking at all of the species of Borrelia, then you're not fully ruling out or testing for Borrelia or Lyme. Does that make sense?
It does.